This is CBS 12 News at 5:30.
Well, tonight's 5:30 Focus, you are what you eat. That phrase coined nearly 200 years ago, but it's really never been more relevant.
Growing research shows Americans' health is directly linked to our lifestyle, and doctors acknowledge a direct link between diet and chronic disease. That is today's 5:30 Focus.
Yeah, later in this report, we're going to be hearing more about the growing debate over fluoride in our drinking water, widely adopted to strengthen teeth and reduce cavities. Some studies now suggest that high levels of fluoride exposure may be linked to health issues, even lower IQs in our children. But first, let's talk about food.
With RFK Jr. now leading the Department of Health and Human Services, many expect significant changes in U.S. health policy. In this special I-Team report, from pharmaceuticals to food additives, companies that manufacture things we put in our bodies are on notice. There's a new sheriff in town. In this special I-Team report, again, we're going to be looking at things we put in our bodies. Jim?
Yeah, and Liz, the numbers really are startling. 72% of American adults are either obese or overweight, and those extra pounds are the single biggest reason most Americans are taking at least one prescription medication every day. Half of those are drugs for cardiovascular disease. Turns out that is the single biggest killer in the U.S., and now, thanks in part to RFK Jr., we're about to take a hard look at what's in the food we eat.
Remember the food pyramid? The U.S. Department of Agriculture now calls its dietary guidelines MyPlate, but not much has changed. MyPlate recommends a low-fat diet with lots of vegetables, fruits, grains, dairy, and lean protein. But with more Americans than ever struggling with weight and sickness, is it time to re-examine those rules?
The problem is, in the 21st century, we're now facing literally a tsunami of so-called chronic diseases that, while they were present in the last century, they're now in literally biblical proportions.
Author and speaker Dr. Robert Lufkin says we're making ourselves sick by the things we're eating.
The one thing we can recommend for everybody is to decrease what are called junk foods or highly processed foods. Now, these foods typically have high carbohydrates. They have, a lot of sugar. They have a lot of high fructose corn syrup. They also have a lot of ultra processed seed oils, which are harmful also. And they usually have a lot of grains.
One study estimates Americans get more than 50% of their daily calories from ultra processed foods, and an alarming 73% of our food supply is considered ultra processed. One way to avoid eating these foods is by checking the ingredients. In the fine print, look for things like sulfites, a preservative that can cause allergic reactions. Nitrates used in processed meats have been linked to an increased risk of cancer. Trans fats from hydrogenated oils are now believed to cause heart disease. And polysorbates, those are commonly used in ice cream, baked goods, cottage cheese, even pickles, to stabilize and emulsify the foods. However, they can disrupt the gut microbiome, leading to metabolic and inflammatory diseases.
You can really trace most of our chronic diseases in this country to a fundamental metabolic problem and inflammation. And a lot of that really comes from putting the wrong foods in our bodies.
Dr. Jessica Chin is among a growing number of doctors who work to educate their patients on healthy eating. She says it's not just our diet that's a problem. The meat from cattle that eat corn and grain in feedlots is very different from those that graze on grass, leaves, and wildflowers.
The steak that's produced in the U.S. that's grain-fed has no omega-3s. Steak, how it used to be 60, 70 years ago, or in a lot of other countries where it's still grass-fed, actually has omega-3 fatty acids. Most people don't realize that just the quality of the meat that we eat is so critical based on how the animals were raised.
So where do we start? Dr. Chen recommends shopping for fresh whole foods, grass-fed meat, and pastured dairy.
I think we're really starting to see a shift because people are starting to get some of those chronic conditions and realize, hey, if I'm in my 40s and I've already had a heart attack or I already have diabetes, this isn't how I want to live the rest of my life.
For the first time, we're hearing on a national level politicians talking about chronic disease and seed oils and grains and junk food. Hopefully this will not be a political issue, and we'll see both parties embrace this because it's really for everybody.
And for years now, a lot of Americans have been advocating for the U.S. to make changes to our food policies. That includes banning harmful additives and pesticides and also eliminating loopholes in the food labeling laws. Often products labeled natural, organic, or even gluten-free, they can still be highly processed and contain a lot of unhealthy ingredients. Liz?
A new study published in the Clinical Nutrition Journal says there is a link between unhealthy eating and accelerated aging. Researchers examined young adult twins, with one consuming processed foods and sugary drinks while the other followed a balanced diet. The study found the twins eating processed foods, grain-fed red meat, and sugary drinks showed signs of cellular aging and chronic inflammation. The twins who ate vegetables, lean protein, and whole grains exhibited healthier biological aging markers.
Yeah, another study, this one by Tufts University, released back in January, it's linking sugar-sweetened beverages to millions of new type 2 diabetes and cardiovascular diseases across the globe. That study highlighting that in 2020 alone, sugary drinks were associated with 2.2 million cases of type 2 diabetes, 1.2 million cases of cardiovascular disease, both of which together killed more than 300,000 Americans every year.
A brand new article in the American Medical Association is raising concerns over fluoride exposure. The study found that higher fluoride exposure was associated with lower IQ scores in children.
RFK Jr. has been a vocal critic of water fluoridation and is on the record now as saying that he could end that long-standing practice, but there are still just as many people who argue it's needed to prevent tooth decay and cavities, especially in areas where kids can't get to the dentist regularly.
CBS 12's Victoria DeCardenas is joining us with more on Florida's plans now for fluoridation. Victoria.
Yeah, Liz and Jim, some Florida lawmakers are proposing a ban on adding fluoride to our drinking water statewide. Cities like Fort Pierce, Stewart, and Port St. Lucie have already removed it after Surgeon General Ladapo recommended against it late last year. But dentists tell me the public is not at risk from fluoridated water. Florida's public utilities may soon stop adding fluoride to the water supply if a vocal group of legislators get their way. Last fall, Surgeon General Dr. Joseph Ladapo pointed to concerns over fluoride causing problems for kids and pregnant women.
I will tell you that the data that we have, the studies that we have, primarily are focused on pregnant women and children. Those are clearly the most sensitive and vulnerable populations for fluoridation in terms of these adverse neuropsychiatric effects.
The Department of Health and Human Services study he's referring to involved research from outside the U.S., where concentrations of fluoride in the water supply were twice as high or higher than they are in the United States. West Palm Beach dentist Dr. Estelle Beresford says fluoridation is meant to help prevent cavities and tooth decay, and our kids are not in danger.
The reason for putting it in the general population was to reach people who could not afford to go to the dentist. The wide population, people in rural places who maybe could see a dentist once a year, once every 5 years.
But what about toothpaste? The toothpaste many of us buy in the store has a lot more fluoride than the water, like 1,000 times more. But you don't eat it, and the small amount you swallow brushing your teeth is nothing to worry about, according to Dr. Beresford and the CDC.
I don't think that you have access to that level of fluoride in the general public. Anything with higher levels of fluoride, toothpaste with higher level of fluoride, those are prescription level.
And if you are worried about fluoride in your toothpaste, there are plenty of fluoride-free options. As for the new law, the legislature goes back to work in 2 weeks. We'll update you on what they decide with that bill. Back to you.
Thanks, Victoria. And as always, CBS 12 News will continue to cover this important topic.
You can look for updates on air and online, and make sure you have the CBS 12 News app downloaded so you can get push alerts sent straight to your phone. We'll be right back.